So this presentation, as Claire has just mentioned, is to really provide a brief overview of how AWTTC and AWTTC are supporting the medicine sustainability agenda in Wales. So the Wellbeing of Future Generations Act of 2015 means that climate is considered at an everyday decision-making level within the NHS in Wales. And the aim for the public sector in Wales is to be carbon neutral by 2030. And this carbon neutral means that the amount of greenhouse gases emitted by the public sector will be balanced by measures that remove an equivalent amount of these gases and given a net carbon impact of 0. With climate change being detrimentally linked to health impacts, the climate change emergency is also recognised as a health emergency. In essence, that the people can't live healthily in an unhealthy world. So AWTTC and AWTTC have a joint pledge to support measures in addressing the climate change emergency. And as with the Wellbeing of Future Generations Act, this is not considered in isolation. For example, as you can see on the screen, is integrated with some of the health inequalities work in relation to access, use and outcomes from medicines. The NHS Wales Decarbonisation Strategic Delivery Plan plans the coordination of NHS Wales's contribution to tackling the climate emergency. And this plan contains 46 initiatives and ranging from things like using LED light bulbs to the increasing use of electric ambulances, and then to increasing the use of low global warming potential medicines. And as you can see, this approach is to healthcare workstream is divided into two main areas, that being healthcare and medicines and waste. So some of you may have attended our best practice day, as both Sabrina and Claire mentioned earlier, and this was held in July, and this had a focus on the environmental impact of medicines and had a wide range of excellent speakers, including those from pharmaceutical industry, Public Health Wales, patients groups such as Asthma and Lung UK, and the Respiratory Health Implementation Group. And I just echo what Sabrina mentioned, that if anybody was unable to attend that day, those videos from those presentations are available on our website and are certainly well worth a look for anybody interested in this area. So AWTTC and AWTTC have been working with colleagues from across Wales on a number of different areas in trying to provide a collaborative approach to the work in relation to medicines. And we have worked with colleagues from RIG, which is the Respiratory Health Implementation Group, for some time. We've previously worked on guidelines to support prescribers in relation to asthma and COPD. And last year and slightly before that, we've been revising those guidelines to include elements around global warming potential of inhalers. So we've had endorsement by AWTTC for these updated guidelines, where each inhaler within the guidelines actually has a symbol alongside it to indicate whether the inhaler is considered one of low global warming potential, which has a green footprint symbol, and then whether it's an inhaler of a higher global warming potential, which is associated with the red footprint symbol. And these symbols generally align so that the green are related to a type of inhalers known as dry powder inhalers or soft mist inhalers, and then the red tend to be the metered dose inhalers, or the MDI inhalers as they're commonly known. This is intended to, both guidelines intended to support prescribers when choosing which inhalers to prescribe for patients. And that choice, of course, in terms of the discussion with patients and where appropriate carers, is a shared decision, and there needs to be obviously an assessment of the patient's inhaler technique before these are prescribed for patients on an ongoing basis. So AWTTC have developed an inhaler decarbonisation dashboard, and this is for access by all healthcare professionals across Wales. Now, the primary aim of this dashboard is to report progress in decreasing the carbon footprint of inhalers while supporting switching from those high global warming potential inhalers to inhalers of lower global warming potential. Again, of course, being a shared decision between the healthcare professional and the patient. And the background work around this dashboard, again, was a collaborative approach with colleagues from the RIG, Public Health Wales and Welsh Government. So in terms of the progress reporting of the dashboard, we have been making summary reports available for public access for a number of months. And as you can see on the screen, these date back to December, and in fact the latest July report has recently been published as well. And these are available from the AWTTC website, and if you put in search terms such as inhaler reports, then you should be able to get to this page where you can access the reports and see really how progress has changed. And I think it's worth, as we go on to the next couple of slides, to see that there has been gradual progress, but that's certainly accelerating now over the last couple of months. So these reports are intended to provide the brief overview of that progress that has been made in reducing the global warming potential contribution from inhalers prescribed in Wales. And I should add that this is using primary care data, which in terms of us being able to put data together is a lot more favourable really than secondary care data, although we have started exploratory work around also looking at secondary care data. So this page is intended to show the progress over the last 3 months compared to the previous 3 months. So we're comparing May, June, July of this year in comparison to February, March and April. Where there is a green arrow, this is to indicate positive change. So as you can see that in this 3 month period, there was a decrease in the indicative carbon footprint for all inhalers. There was a decrease in the use of the MDI type of inhalers, which are those positive outcomes, but also there was an increase in the DPI and SMI type of inhalers, the more favourable lower global warming potential inhalers, which is also a positive outcome. This rather more busier page of the report provides monthly data. So this is considering just each month that's reported. So we have data, as you can see, going back to April 2018. So the top 3 show actual data for the individual months, and the bottom 3 show change. And again, you can see that the indicative carbon footprint for July and the indicative carbon footprint per item for July have both decreased, which again is positive. Although you can see that the items slightly increased. Now this is overall items, and this is likely to be driven, we think, by an increase possibly in the more favourable type of inhalers. But again, we're needing a little bit more monthly data really to show if there's a continuing pattern. So this rather more plain graph is highlighting the use of a specific type of therapy known as the short-acting beta agonist inhalers. So these more commonly known as some of the brand names, Ventolin, Salamol, and these are used in an acute situation where patients are experiencing wheeze. There is concern, and there's been concern for a number of years, and it's not just within Wales, but really across the world, in terms of the overuse of the SABA inhalers. And the overuse is these inhalers is actually associated with poorer asthma control for patients. And therefore, there's a lot of work currently ongoing in trying to address this and trying to reduce the use of these SABA inhalers, not only from the carbon footprint point of view, but also in terms of improving patient care. So the lower line is the percentage of inhaler items that the SABAs make up. And the top line is the percentage of total carbon footprint that the this inhaler group contributes to. And as I think you can see that in general, the top line is starting to show that little bit of progress, which we think is probably linked to two factors: movement from the Ventolin brand to the Salamor brand, which has a slightly lower carbon footprint, but also that there is a move to switching from these MDI type of SAVA inhalers to the DPI type. And again, we're hoping that future months' data will give us reassurance that there's a continuing pattern. But as with a lot of the work around this, there's certainly a long way to go. So inhalers, as you may have guessed from the amount of time that we've been addressing those so far, have been the majority focus of the work within AWTTC and AWMSG so far. However, there has been additional work that has also been done, and this is continuing as well, where we're working with decision support software manufacturers to incorporate messages to prompt prescribers to discuss the global warming potential inhalers with patients. We're developing a patient information leaflet, which we are going to share with you a little later. And we're also working on an inhaler decarbonisation strategy. And this is due for consultation soon. And as with all our consultations, obviously, we'd really welcome any responses that you would like to make. So as mentioned at the start of the short presentation, that sustainability is much wider than just the inhalers. And there will be, as mentioned, the additional work that's ongoing, as well as, I'm sure, many other aspects that will contribute to addressing the requirements of decreasing the global warming potential contribution of medicines. So that concludes this short presentation. Thank you.